Hi guys, today we're back with the special episode about our techniques for dermal fillers. Whether we prefer either needles versus cannulas.
So one of the things that I've noticed on Instagram particularly more recently is people kind of bragging about the fact that they only use cannula. Oh, we only use cannula for this, we only use cannula for that. Which I think is kind of really annoying because you actually need to use a needle to get a cannula in there in the first place. And why limit yourself? Thoughts?
Thoughts are that both are very, very good for different purposes. So I mix needle and cannula in my practice every day. I cannot just get by with a cannula and I cannot just get by with a needle for various different reasons, which I guess we're going to discuss as we go throughout the video.
Yeah.
Yeah, ditto to what you said, because I think it's a little bit short-sighted to say that I only use one thing. I mean, I have heard exactly the same things even in teaching sessions.
Yeah.
And I just think it's silly.
Well, and also it's just not true,
Yeah.
because you need to use a needle to get a cannula in the skin because it's blunt on the end. It's not going to go in. It's ridiculous.
So for anyone at home that doesn't know, a needle is a needle. It's sharp, it's going to pierce through the tissues very easily. A cannula is a blunt, hollow tube with a little hole on the side that the filler comes out of. You can't get that through the skin without using a little needle to poke a hole first.
It winds me up. It really winds me up. I'm not going to lie.
It's your bugbear.
It really is. Yeah.
So guys, why do you prefer needle?
Well, there are things that you can't do with a cannula that you can do with a needle. For example, really superficial injections. So if you need to get something like just into the dermis, I'm always going to use a needle for that.
Great. And you, Ewan, why do you like a needle?
I guess if you're wanting to deliver product directly down onto bone, which we often do in the face to restore volume, you're best just to use a needle, really, if you want to give that precision, because you always know that you're on bone, whereas cannula, you don't get the same tactile feedback.
With needle, the precision is the thing that I like because the product is delivered literally from the tip of the needle, as opposed to cannula, where the port of exit of the product is actually a little bit further back from the tip.
Yeah, just by a few millimetres.
So with needle, you really know where you are. And why do you like cannula?
Because you can reach a very large surface area using just one entry point. So it means less stabs for the patient.
That's always good. And you?
I think you guys know that I love my anatomy, so if you're in a plane in the tissues where the blood vessels lie, it's very safe to use a cannula because it's blunt. It doesn't penetrate the blood vessel as easily as a needle, especially if you're using a slightly larger size cannula. One entry point, like you said, you can access many areas, but the safety element is the crucial thing for me.
Okay, so ditto and ditto. Also, I find using it is like a little bit like a paintbrush. So when you've got it in the tissue plane that you want, you can just go back and forth until you've really created something that's much more smooth, really, really harmonious. You can really tweak it.
What about pain? Do you guys think it hurts more having a needle or a cannula?
Depends how long you're having it done for. I suppose there are some planes that a cannula will slide through that are uncomfortable. People have this thing again on social media about how cannula is painless. I've had plenty of cannulas. It's not always painless. There are some planes that it is uncomfortable in, and there's certain ligaments that you might need to go through to get to certain areas, especially around the eyes, or some ligaments in the cheeks that you have to pass through, and it does hurt a bit when they pop through. So I suppose if you're having one quick needle versus a slightly longer cannula treatment where you're moving around large areas, I would say maybe the cannula could be more uncomfortable.
And from personal experience, when I've had needle with other injectors, it's been fine. It's been relatively painless. When I've had cannula with both of you, it's been relatively painless.
I thought you were going to say something completely different there.
Terrible.
Yeah, it's true though. I was quite surprised.
So using a needle superficially is really good for people who have got maybe etched in lines, just really, really superficial, small, tiny creases, or very young people's nasolabial folds if they're very slim.
So when I say using a needle down onto bone, that probably sounds quite terrifying, but for an injector, a needle down onto bone is a very safe plane. There don't tend to be many vessels lying on the surface of the bone, so we get that tactile sensation with the needle. We know we're in a safe plane, so that's why it's quite a nice technique for that purpose.
With some needle techniques, it's possible to do something called aspiration, which is where we put the needle through the skin and then we basically pull back on the plunger to create a vacuum. And if the tip of the needle is inside a blood vessel, then often blood will come up into the hub of the needle and will then be able to move where the injection is going to be, because you don't want to inject inside of a blood vessel. However, that doesn't always work because it's dependent on whether or not you have a wide gauge of the needle and whether or not the needle has previously been used as well. So if there's some product in there. So some products you can aspirate with, some gauges of needle you can aspirate with, some you can't. Okay, so we're going to play the game now. We're going to talk about whether we're going to use needle or cannula for the majority of time in that particular area. Not all the time, just to be very clear, just the majority of time. Okay, so forehead, go. Oh,
Needle.
Needle.
Okay.
Interesting.
Most of the time.
Interesting. Okay, talk.
I'm going to use my gorgeous assistant. I use a cannula most of the time, deep down above the plane of the bone, and I come along in this direction. And the reason I come along this direction is because the blood vessels go the other way. So I'm going to come across them and deep to them, and I can slide along and fill slowly, carefully, because this is a high risk zone in this area with the two arteries that come up the forehead. And I feel more comfortable if I'm coming at them from a different angle to the way they're running, because I'm not at risk of shooting up and filling the whole thing. So I come across gently, slowly, and I can cover a large area with the cannula.
I would like to add also that, oh no, I don't need the head, it's fine. Yeah, it's more of an esoteric thing. So I feel like I can get more volume in when I'm using a cannula, because you can break up some of the fibrous bands there, and you can, it just makes it a lot easier to fill. I do find that if I use a cannula, I need to use anaesthetic, so I always put a drop of local anaesthetic at the cannula entry points, and I use 2 different entry points normally, not always, because you can't say never, can you? But that's why I use cannula, in addition to that reason.
And I suppose I'm the wild card here, because I quite like filling this region here, which is about 2 centimetres above the brow. And in this region, the arteries become more superficial, and therefore I give little injections onto the bone, and I find that works really, really well, just to bring out that mid-crease, I suppose.
I suppose what we're talking about is doing 2 slightly different techniques here, because you're talking about filling the space just above the ridge,
Yeah.
and we're talking about making the forehead a lot more rounded.
That's right.
Yeah.
Yeah. And when I get people who want this area filled up and volumized, I do use cannula for that. Yeah. So it's a cheat, sorry.
Yeah, interesting.
Also,
Interesting, though.
glabellar lines, I find that patients who don't do well with Botox in this area because the lines are really deeply etched in, some really, really superficial needle treatments there can be really helpful.
Next up, we've got temple.
Are we needling?
Yeah.
Ah.
Mostly, but not always using a needle, right?
Yeah. Yeah.
Why are we using a needle in the temple more than a cannula?
I think, okay, from my perspective, I find it easier to use a needle there, because I find that sometimes with a cannula, that area can look a bit puffy, because you have to inject very superficially if you're going to do it with a cannula. And sometimes you can get some contour irregularity afterwards. You don't get that with a needle.
I find that you get really precise delivery of the product into the temporal fossa there. And the other thing is it's much less painful than a cannula, I think.
It's definitely an easier technique, isn't it, using the needle? Some people call it the gunshot technique, which sounds really terrifying. But that basically is when you go into this area, just kind of lateral or to the side of your eyebrow, and you go down to touch bone and deliver your product in the depth of the dip in your bone there, the temporal fossa, to try and lift it out. But you can use a cannula over the top in a much more superficial, so more shallow plane, just to even the skin out. And sometimes you have to do both, because temples are deep, aren't they? They take a lot of product, the little wells.
Yeah.
All right, next up, there is the cheek.
Cannula, both. Me
Both.
too.
Yeah.
All right, so I suppose I have to justify. Okay, so I like to use cannula in the cheek because I feel like I can create a sharper line there if somebody's wanting to have a cheekbone augmentation. Also, it means that I can reach the whole length of the arch using just one injection, so I think it's less painful for the patient as well.
I think I used them 50-50. I just couldn't choose one or the other for this one, because I'd probably do 50-50. If I have a slightly older patient that needs a lift to their face, it's usually because the bone has shrunk back a bit in the mid-face. And if I'm thinking about where I'm placing my filler, I want to try and recreate what's been lost. So I want to use injections down onto the bone to build that structure back. Then if I'm thinking about the fat pads that have shrunk back, then I'll use the cannula in those fat pads to try and build them up. But you're right, if you want a sculpted cheekbone, a cannula is definitely the nicest way to get a sculpted cheekbone.
I think especially for that top model look,
Yes.
yeah, a good cannula is really helpful there. I'm the same as you. I was trying to think, what do I use most of? And it is actually, in most patients, I'm doing deep with a needle technique, and then I do superficially with a cannula technique.
We have our infraorbital artery, which comes out of a little hole just underneath your eye there. It's one of the major arteries supplying the middle of your face, so we just need to be really careful, especially if we're using a needle. We're not placing it too close to that part of the cheek.
Yeah.
But other parts, further down, for example, or a little bit more laterally, there are other arteries that come along the cheekbone. The transverse facial artery does, but you don't tend to get too much of an issue with that, I've found, with a needle. Have you guys come a cropper with that before? Occasionally a little bruise.
Sometimes, yeah, you can get a little bruise there.
Yeah.
Next up, tear trough.
Yeah.
Oh.
Ooh, interesting.
We're so different today, aren't we?
So, Sarah, because you're the outlier today, so why would you use needle for tear trough?
Because in my hands, I find it more precise
Okay.
than using a cannula.
And I've seen you do the technique, and in fact you've done the technique on me, where you've done several little boluses along the infraorbital rim, sort of the bottom of the eye socket, and that's lifted things out really nicely. And as you say, it's very, very precise. And then Ewan, why do you like cannula for the tear trough?
I like cannula. It's one entry point, so it's not multiple injections. And I like that I can cover all of the tear trough from that one entry point. I feel like in my hands, I can deliver the product more predictably and smoothly in a nice plane. It just works for me. I do the needle technique sometimes. I even did it for you. But for me, most of the time it will be cannula.
And what do you use product-wise generally with cannula?
Almost always Redensity 2 by Teoxane for the under eye for me. And you guys?
So I use cannula just to paint in really, really light amounts of Vital Light. And I find that works really well in my hands.
Yeah, I'm a big fan of the Redensity 2 and 1. But if I'm using the 1, I will use the cannula there. So, you know.
Yeah.
I should also say as well that when I say I'm using a needle, I actually transfer the product into a smaller syringe. I use an insulin syringe when I'm injecting around the eye because the gauge is much finer.
Yeah, you barely feel them.
Yeah.
Next up, we've got lips.
Really?
Really?
Yeah, not 100% of the time, but I would say 90%
I
of
am
the time.
shocked.
That's crazy.
Yeah.
Justify your actions.
Yeah.
I quite like it. Again, it's that sort of the control. I can really, really slowly sort of create something really nice in terms of the border and then the body. And if you're working in the body of the lip, it's just so much safer, I think. Yeah. Not convinced. I use needle as well, but I definitely use cannula more.
Wow, yeah. Interesting.
And I can also use from that one entry point, you know those smoker's lines as well? It's quite nice to go up there above the lip and sort of soften them up as well.
I just prefer personally to use needle. I understand that having lots of needle pokes around the lip is uncomfortable at times for patients. We can numb them with really strong cream or a dental block. Benefits of us both, all of us being dual trained as dentists and doctors. But for me, the precision of a needle, being able to place the product very directly, makes it a winner for me. And I feel like cannula is good for kind of global volumization, but you don't get quite the same amount of definition and sculpting that you do with a needle.
I use cannula from trying to widen the mouth.
Yes.
A lot.
it does that.
Oh, I like a needle because I like to place it very superficially. And we had another video recently as well about doing the Russian lip or tenting, which of course you can't do with a cannula.
Yeah,
No.
yeah, of course.
Last but not least, nasolabial fold. Ooh.
Oh, we've all done a different one.
That's interesting because nasolabial fold is sort of day one at aesthetic school, isn't it?
Yeah.
And it
So-
shouldn't be, by the way.
Yeah.
It's one of the
It's-
highest risks areas. to
Absolutely.
treat.
So tell us why, Ewan.
Why? Well, very, very important blood vessel runs directly in the nasolabial fold, which is our facial artery coming all the way up here, and it supplies most of the external face with blood. So it's definitely not an area you're going to want to mess around with or get wrong. So this is why, personally, I feel more comfortable using a cannula. Now, I'm not saying I use it 100% of the time, but I would probably say 90. Because with it being blunt, if for whatever reason I'm unfortunate enough to contact the artery, it's got a very low risk of actually entering the artery. And usually a blunt-ended cannula, especially of the size that I use, will then just push the vessel away rather than entering and causing me a lot of stress. So Kish, you are the king of needles.
Did
right
say
now.
needle.
Why are you using a needle?
So I find that with nasolabial folds, particularly if it's an established fold, it really starts off here in the piriform fossa. So if I've got someone saying, I don't like these lines, if I just put like a bolus here and here, that's often enough to make them feel a lot better and lift out the fold. I do use cannula as well, to be honest, but often that's enough.
And why are you being greedy and choosing both?
Because that's actually the reality. I do use both. So if I'm going to be injecting into the piriform fossa, I actually prefer doing it with a needle because I like that feedback that I'm definitely going to be on the bone there. But sometimes I will use a cannula 50% of the time to do it. I don't know. I'm just greedy.
Yeah. Fair.
Okay guys, I hope you liked that episode. Let us know if you've had cannula or needle treatment yourselves and what was your personal favourite. See you again next week for another video. Bye for now.